Welcome to COIQ, where you learn how health innovators maximize their success. I'm your host, Dr. Roxy, founder of Legacy DNA and international best-selling author of How Health Innovators Maximize Market Success. Through candid conversations with health innovators, early adopters, and influencers, you'll learn how to bring your innovation from idea to startup to market domination. And now, let's jump into the latest episode of COIQ. Welcome to the show, COIQ listeners. On today's episode, I have Anthony Dohrmann with me. He is the CEO and founder of the Electronic Caregiver, and he is going to talk about this groundbreaking innovation, Addison. We'll learn more about that today. Welcome to the show, Tony.
Thank you for having me on. I really appreciate it. Very excited.
Tony, Anthony, here I go, right?
Okay.
So let's start off by telling our listeners a little bit about what you do and what Addison is all about.
Well, we are in evidence-based. We've been heavily involved in research to develop our products, but we're a virtual care company. And so one of the hot subjects right now is all about telehealth, what telehealth can do to carry the burden during this time where we've got this pandemic. And we've always been involved in providing telehealth services. But when you look at our population, we have about 48 million older adults who, when we have a pandemic, are most at risk. And that population is about to double in size. And the majority of them have at least one chronic illness, many of them two comorbidities.
Yep.
And so telehealth is very episodic, right? A doctor may schedule a routine visit, or you may request a session because you're not feeling well. What we found is that the biggest challenges in healthcare revolve around outcomes and adherence. And a lot of the spending, the majority of the spending of $3.7 trillion is for chronic disease management. And then on the treatment adherence side, we've got a problem where, and this is around the world, it's not just in the US, half of all treatment failures, half of all treatment failures are attributed to non-adherence. All of this is happening, right? The support for chronic disease is happening, needs to happen in the home. It's a continual process. It's not a periodic, episodic process.
Yep.
So what we wanted to bring was advanced technology that had the capability and the intelligence to be able to unpack day to day a care plan, a treatment plan, and to be able to walk caregivers and patients through that care plan, to be able to monitor their progress, their performance, to be able to use artificial intelligence to identify the very earliest stages of decline, functional decline, cognitive decline, to be able to faster see signs of infectious disease, for instance, to keep with current events. And so we wanted to create a virtual caregiver. And it was a very big project. People told us it was impossible, because to do this well, it involves a lot of different coordination between health stakeholders. You've got the patient and providers and potentially other care teams and family members. And then you've got to have a technology that is simple to use for people that may be suffering or struggling the other side of a diagnosis. Maybe they do have some memory loss or cognitive decline. They might be compromised physically in other ways. So we wanted to create a voice-based virtual caregiver capable of forming a unique relationship with the user, the customer or patient, something that captivated them, where they didn't have to reach out to the technology. The technology would reach out and embrace them. And so we've got voice, but sometimes we need to demonstrate a physical therapy routine, or we need to remind them how to use one of their peripheral devices to take a vital reading. And, there's a whole host of things that we need to demonstrate. So, we're all familiar with Alexa, right?
Yeah.
we loved voice. We were very early on with AWS. I think we wrote the very first health skill for Alexa in 2014. But I couldn't form a relationship with the speaker grill. And I couldn't get that demonstration capability. So we decided to give that voice a better set of ears, set of eyes, a face, a body, a personality with empathy and humor, and basically the brain of a nurse practitioner. Right? That might be overstepping a little bit because you can't replace it. But
right.
we needed her to be very capable and very intelligent. And so that's what we've created. It's taken us 10 years. People said it would cost $500 million. We did it for about $60 million. It required 8 years of putting together a very special screening laboratory and then infusing that with a lot of technology from some of the biggest names in tech. We participated with development teams and development support teams from Microsoft, from Google, from Apple, from AWS, and from Intel. And we deployed this laboratory in 32 states. We organized hundreds of providers and senior care professionals. And as we did that, we started learning some other things that we needed to address, other challenges in the market. For instance, 27% of our children are living with a chronic illness or a disability, and they often require continual oversight. And as you get into these pockets, I'll stop talking because you're never going to be able to ask me a question if I don't stop. But when you get into these pockets of populations, of people that are high risk or that need a lot of high touch and a lot of oversight, whether they're children going through various developmental stages with a disease or disability, or whether you've got an older, adult who's in some form of continual decline, so much pressure on caregivers, and not a lot of resources and support for them. Live care is very expensive. Even part-time live caregiving for the older adults is beyond the financial reach of 97% of Americans if you look at the income levels and the starting costs for part-time care. And so we really had to be effective and considerate of these, approximate 50 million family caregivers providing 30 billion hours of service a year, and figure out not only how to care for these patients who range across all disease spectrums and ages, had to be really cognizant of developing support tools for those caregivers that have very little help.
So I want to talk about, what you're describing here is obviously you're solving a lot of different problems. When you talk about, artificial intelligence and virtual reality and voice, it's definitely groundbreaking and revolutionary. And a lot of times we have the perception that this is really exciting, because it is, and very glamorous, right? You think about, Steve Jobs with the iPhone or Elon Musk with the Tesla. It's like, oh my gosh, these guys are coming up with something that's just, we never heard of. We didn't even think it was possible. And you kind of think it's really glamorous. So walk our listeners through, just some of the realities of what it's like when you have an idea for a radical innovation that no one's ever heard of before. They don't believe it's possible. And you still are holding tight to that dream and having it come to fruition.
So from the entrepreneurs and innovators mindset, the public will always say, wow, look what they've done. And when things take off and get traction, you'll often hear overnight success.
Right.
It is the most discouraging, grueling, frustrating journey to do something that's fairly complex. And it doesn't just take, it's not just the person who founds it and leads it who's got to be the continual, cheerleader, who's got to be steadfast and faithful and focused to the mission. But you got to be very good at developing a team of people who have those same types of qualities.
Mm-hmm.
When you go out to the market, like I had gone to Silicon Valley, and they said, what is it that you want to do? What are you coming to us for funding for?
Yep.
I said, well, we're going to build a virtual caregiver. Voice, edge computing, visual sensing, tying in some wearables, we're tying in customized plans of care, 3D animation. Went through this whole list. And we said, but that's, to get from here to there, there's some other things that have to happen first. We're going to develop an enterprise solution to manage our customers, our devices, our care plans, the health data, the security, to manage the whole business. Then we're going to build this lab and deploy it for, at the time we said, 4 or 5 years. And we're going to coordinate all these tech companies, coordinate all these health professionals, and organize thousands of patients to screen. And we've got a roadmap for 3 products. The third one is the virtual caregiver, Addison Care. The first 2 start to provide some digital health solutions, some connected care.
Mm-hmm.
So we described a simplistic device, one we put into the Medicare system that had peripherals and did a lot of health monitoring and medication management and voice-based in-home custom assessments like home exams. And then we get to the virtual. They said, you should have naive and stupid printed on your forehead. You're going to put things out in the market. You have no idea if you can actually monetize them. You don't know if you can get the tech companies. You don't know if you can get the providers organized to help you organize patients. No idea if any of what you'll collect is viable. The costs are so unknown. This is a project where, as you just went through the different components, we were adding up, what does it usually cost to do an enterprise solution? What does it usually take to launch a couple products? What does it take to launch, develop a go-to-market network,
Yep.
for sales and distribution and support? And they said, what you've described involves technology that some exist, some in the early stages, never been coordinated like this. You're talking about a $300 to more likely $500 million plus investment. Nobody's going to back you. You should try to choose one small component. I said, everybody's working on one small component, but that doesn't reimagine and transform health.
Right. Yep.
So when you start down this journey, sometimes you've got a big vision. And, when you look at how you get things funded, well, there might be 1 in 500 deals that go to traditional equity funds like venture capital that actually get to term sheet, but it's probably closer to like 1 in 1,000 that actually get funded. So what happens to the other 999 entrepreneurs?
Right.
They've got to learn how to structure a capital offer, how to go out to high net worth investors and learn how to have that engagement, that communication, diffuse or overcome their concerns and doubts. And even when you do that well, you're going to have a much bigger percentage of people telling you no, and nobody just says no. Right? They give you a list of all the reasons why they're certain you're going to fail. Right?
Yeah. Yeah.
So, and so you feel like your character and integrity and values in question at all times.
Yeah, because your identity is wrapped up into this vision. In so many ways.
It really is. No matter how much you try to say, I don't want work to be my identity. Work is who I am as a husband or who I am with my faith in at church.
Right.
It's all consuming.
Yeah.
And so, now if you're lucky enough to get some capital, one of the most common mistakes is that people completely misassess how much capital they need. For instance, they a lot of times think from a small team mindset. So if they haven't taken something to market or put a product into production or built a big development team or run a customer service department or gone through in healthcare, you might need to go through clinical trials. You might need to get FDA approval. You might build something that you've got to put patents around. And if it has, telecommunications in it, you might be getting FCC certification or UL certification. And, people think in terms of, if I just get this money, I can do this, and I can't do anything. I mean, it's the skill sets throughout our building are diverse, and they're, people that are well educated have had to go through years of a learning curve still and reach out to other mentors. It takes a big team. We usually think, well, if I can just get this money, I can start building and pay a couple consultants and outsource a few things, and it's going to happen. And so they don't realize in the beginning stages, your job is going to be 100% chasing the money and getting the company capitalized. We also have the burden of building a team and then managing a team. And if you're good and you start getting that process down, it becomes more intense, because usually in healthcare, health moves slow. Product development is slow. We're not talking about, app on mobile. Everybody can build an app. Hundreds of thousands of people have done it. That isn't going to transform our issues with global health. It's a component, an extension of, the core platform or services. Just like telehealth can't be the core. If you just do the episodic and you're not doing the continuous engagement and monitoring and keeping on track with the care plan, supporting the caregiver, all those other things, early identification, you can't transform care. So the things tend to be more complex with longer lead cycles. They're very expensive. And I'll tell you one of the things that people never consider when they're budgeting and forecasting: mistakes. For some reason, everybody thinks I'm going to get it the first time. It's like, there are going to be mistakes. Mistakes might be on the capital side. You might organize a meeting and host a dinner or serve hors d'oeuvres or, do whatever you can. You try to keep it on the cheap in the beginning. But you travel and you bring prototypes, or you're printing 4-color, illustrative, samples to show people, here's how our marketing's going to look like. Here's our product's going to look. And you get out there and you get nervous because people have been pounding you and filling you with doubt about your own mission and vision.
Yep.
And you have a bad talk. Now you've spent thousands of dollars, and all you've done because of a bad talk, or you didn't handle some objectives, or somebody hit you with a curveball. You haven't evolved enough to even understand that's a problem yet, so you certainly don't know how to answer it, right? And so that's going to happen over and over and over again. And then when you get into the development, there's mistakes. I remember, so I had a big national security company, and I wanted to be the first one to develop kind of a do-it-yourself, professionally monitored plug-and-go security system. And I had an idea about how it should function and how it should look. And I thought, this is going to be great, because like people that live in rented apartments and homes get burglarized like 80% more than people that own their homes. I thought this is going to be great for the rental market. And my channel was going to be through major retail. And at the time, it was a big sell because ADT, Black & Decker, Brinks, Schlage, Magnavox, GE, they'd all categorically failed at the time trying to do this. I wasn't just going to sell, some components. I wanted you to activate it like a cell phone for a service. And it's funny, I'm not going to mention the names, but even today, more than a decade later, 15 years later, I've seen some big companies make the attempt to do it and haven't been able to do it. We actually put the whole program together. And until the retailers crashed and went out of business like Circuit City and CompUSA, we had an unbelievable success rate. But while we were doing the development, I created this kind of pyramid-looking, cool little high-tech device. And we actually had purchase orders for tests with like Ace Hardware and CompUSA at the time. And we're in production, and I have a sales guy come on board. I finally got enough capital to get somebody who's really seasoned. And he said, I am not putting this out and doing the big shows at CES and meeting retail buyers if you've not focus grouped this. And I said, Howard, I run this big, at the time I was managing this big national entrepreneurial seminar business, and thought I knew everything. I've been exposed to tens of thousands of deals. I was the consultant to all these other, emerging businesses. So I said, Howard, I put this out in front of thousands of people at the seminar. They all love it. He said, those people have got you on a pedestal. They're not going to be objective.
Nobody's telling you your baby's ugly.
Yeah, whatever you put out there, they're going to say, if he thinks it's great, I think it's great. So you're getting skewed advice. So we go into these focus groups, and I can't wait. We're big, you know, the two-way glass. We're like hidden behind the mirror, and I've got stockholders there, big ones, and we're in production in China at the time. Right? So they go through the pricing, the name, you know, what it's going to do. Everybody says, you know, wow, it's great. Wow, that would be really useful. Yeah, you know, I could use it, but my mom could use it. And then they unveil it. And I mean, there was this visceral reaction. People like pushed back in their chair and they went, whoa, I mean, my wife's never going to let that be in the house. I mean, it doesn't look like that. Hey, you know, the way you've configured it, like where you want to plug that in, I don't have a convenient phone line. I'd want that part to be separate from the main. So we went through 2 rounds, and I had to shut down production in China, call up retailers and tell them, you know, I had a good story. When you have these bad things happen, you better have a good plan that you can explain in great detail. So people say, it happens, but you're taking the information, you're not ignoring and denying it, you're acting. But that was, you know, about $1.5 million error. And the factory now wonders, they've ordered all these parts, they put thousands of people on these production lines to work, and they schedule that in between other builds. So, you know, you have to maintain the confidence of your factory. You've got to make sure you can maintain the confidence of your retailer. And so we had a good communication for them. And then you now have the expense of redesigning the entire product. And then that changes the pricing, the packaging, all the collateral material, all the photography, everything changes. And now you've got to put that out to focus group and make sure you got it right before you take it out in the market. So we're about to do a round of some new focus group studies. We've been, you know, bringing in people who represent actual users, and now we're going in with some of our new product releases into these focus groups. You know, the first small one that we're going to do is about $38,000. It's not cheap. Do 3 or 4 of those. I think we probably invested in this project. Gosh, I mean, we must be at close to $1 million in legal work on patents. People don't realize how much it can cost.
Well, and I want to pause about the product and the focus group because, you know, that is just something that is so prevalent in this industry. I was talking to a physician entrepreneur a few weeks ago, and, you know, it's someone who is keenly aware of the problem because he faces it as a surgeon every day, right? And so he comes up with an idea of how he's going to solve it, and he's really excited about it. And, you know, being the perfectionist that he is, puts in every bell, whistle, feature, functionality that you could possibly have. It's in the App Store. You can go and download it today. And there's been no focus groups, no market research, and really not even any consideration for commercial viability out of his own use case. And very little resources for actually bringing it to market, for actually commercializing it. And it just, like you said, it happens all the time.
It happens all the time, and it's much more expensive than people think to build a product. And you know, I've seen something else too. So if you've never gone out and done direct sales, or, I mean, I've done stuff in big box retail, specialty retailer, club retailers. We've done distributorships. I've been on QVC myself and marketed products on QVC through direct response. And then there's, you know, all of the e-commerce and online components, but they're all very expensive to get from, you know, product development to this point. But one of the things I've seen over the years over and over again is, you know, the idea person who's not been through all the nuances and costs and what needs to be in place to make this successful. It's very, very big problem with engineers, right? I have this idea I think is going to help people or make a difference, or a lot of people are going to love this and buy it. So they make stuff they think is cool, and it's the wrong approach. You've really got to dig deep into who's going to use this product, who's your ultimate customer. You've got to know everything about that customer. You have to throw a lot of concepts and alternatives in front of that customer and figure out what they actually want, what meets their needs, what they find desirable, what they find useful. You've got to make sure that you can measure, how does this work? And this is really big. How does this work from a price point? Like, can you get this built at a price point that they'll respond and adopt it, right? But sometimes people don't realize the process of compensating the people that will help bring you that customer, carry your product to that customer, also have to be in the revenue chain. Sure. And so sometimes you think you've got your margin set up, and then you realize, I don't have enough, like the economics don't work. I see a lot of people, and we've actually been a little accused of this, to be honest with you, on this particular product, Addison Care, right? Overbuilding. At some point, when you've worked back from the customer, and you've moved through your channel relationships and looked at how to structure the economics and how to deliver your product, and then support it, because there's costs in supporting things, especially if they're attached to any kind of service. And sometimes they're not attached to a service, but they are subject to ongoing scrutiny or review or fees for certifications to meet regulatory compliance. So there's always ongoing costs, warranty replacement. So then you work yourself, all the way back to the start. And you, at some point, once you've answered those questions, you got to make a decision on minimum viable product and not add every single bell and whistle. It's better to get a first product that's, well designed and provides, great services or benefits to your customer. Let them give you the feedback.
Yeah.
Let them tell you what they'd like to hear.
Definitely.
And in that, inexperience can get you in trouble, because I also see somebody will get 1,000 customers and 2 distributors and 1 customer, 2 distributors out of 1,000. 1, 2, 3 customers, and they're very noisy. They're just demanding that they have this thing, or 1 member of the press. And all of a sudden, without any in-depth study, without taking that to other people, without asking yourself, is this a priority as compared to the other priorities we had previously designated? Where should this be in the stack of priorities? They don't do that. They make knee-jerk reactions, and suddenly there's redesigns, a new marketing literature, and new spins on things, and it's...
Before you know it, you're in a whole new business that you weren't even really intending to be in. And now your whole product development has been taken over by your customers. And, it works for them. I mean, that is a very common pitfall in the innovation process, is that, you've got those customers that buy first, those innovators, those early adopters, they're visionaries. They want the competitive edge. They're the ones that buy first. That's why they buy, right? And so then once they buy, their vision doesn't stop. Their competitive advantage doesn't stop. They want to do this next and do this next. And they're so excited. And it's so easy to kind of get caught up in that momentum, especially depending on where you are in your financial situation, right? I might feel like I have some responsibility or requirement to continue to develop what they want, because I need to keep the lights on if I don't have enough cash. And then before you know it, you're just, like I said, in a completely different business, and you're like, wait a minute, how in the world did we get here? And that whole radical differentiation strategy that you started off with is just completely diluted. Yeah.
Hey, it's Dr. Roxy here with a quick break from the conversation. Do you want your innovation to succeed, to change lives, to shape the future of healthcare? I want that for every health innovator, which is why I invented COIQ, an evidence-based framework to take your innovation from an idea to startup to full market adoption. If you're not sure where you are in the commercialization process, take the free assessment now at drroxy.com/score. Don't miss out on impacting more lives just because you have a low COIQ score. The free assessment is at drroxie.com/score. That's drroxie.com/SCORE. And now let's jump back into the conversation.
There's such a balance between not letting the distractions and understanding with good experience and discernment, and then have a process in place to interpret what you should respond to and what you shouldn't. You got to hold your focus to get to a viable product. But you bring up another great point, which is, evolving the product, adaptation, the ability to pivot. If you get something out there successful, people will find other ways to apply this product into other places. Right. And sometimes we get people that are so riveted. Now, here's a big thing, a big cause of this. It comes back to capital again. They get so focused, they won't adapt. There's a lot of founders out there that won't adapt business models.
Yep.
It's hard to walk the line of pushing through and holding your focus and not letting disruptions come in and take you off track, and knowing that there are times to diversify, times to develop, times to pivot, right? We've had to do a lot of pivoting because of COVID-19, right? COVID-19.
Yep.
Big pivots in the business. We've had all kinds of business, structure set up for going to market.
This week is crazy. Every client that we have is like, whatever strategy we had in place, put the brakes. Now we need a COVID strategy.
Yeah.
And rightfully so, because it's, the assumptions and the strategies and tactics that we believed were going to be most effective last week aren't necessarily going to be our best path this week.
Well, and I really feel there are going to be, the layoffs and job losses are in the millions.
Yeah.
Right? And, for some people, this is going to be a breaking point. For other people, it'll be a making point, right? There might be some people out there that have had dreams on the shelf and different ideas, and maybe this will be the thing that urges them to finally pursue that thing that they've always wanted to do for a living every day. That there was a point where at a point in time many years ago that happened for me. It was through unexpected circumstances I embarked on this, entrepreneurial quest, right?
Mm-hmm.
I said there was that one key skill set. I think the ability, and this really spreads through the whole organization, the ability to develop capital. Because it's really about developing belief and support and compelling the people around you to get behind your mission, your purpose, and what you're going to deliver, and how you're going to transform the human experience in your unique way.
Yeah.
It is the master skill because, like I said earlier, most equity funds, VCs, angel groups, they'll reject, all but 1 in 1,000 deals. And they're inundated. It's hard to even get into the lineup to even have that one shot. And they can be very difficult to deal with, right? So you see a lot of deals where, and you just go on and search the internet, people have sold away their companies. I see people that come and want to pitch for a job here, and they've been involved in a senior leadership position in 3 different venture-backed deals. And I say, if you had done this right and been smart enough, you would have become the VC after your first deal or your second deal. You wouldn't be on your 3rd or 4th VC deal. Getting involved with founders that are selling away everything.
Right.
And it's tough because people don't see that coming. There's initial seed round, and then suddenly you need another development round. And then all of a sudden you need some go-to-market money, and then you need growth money. So these different stages through development and different needs, and they typically are increasing over time. So you go out and you leverage your home, and you drain your bank account or pull money from a 401k.
Or your kid's college fund.
College money. And now that's on the line. Now you got, get connected with some lawyer who helps you put a little offering together, but it doesn't have any experience with structuring a business. It's not how you're going to capitalize your startup. It's how you're going to capitalize it all the way through to some form of, where it can continuously sustain itself and become very profitable, or you get to an exit where you're acquired, or, you go to an IPO. And so, you have to think long term. So they'll drain their own resources, be on the brink of disaster and collapse, finally figure out how to get some friends and family money in, but didn't structure the deal to give the room or set the expectation in advance for the larger capital to come in later. Now they get out to a venture firm, and maybe the venture firm likes it. It happens over and over again. There is the group of the deals they like.
Yep.
By the time that deal's done, and people ever see this coming, they'll say, how much money you got in the bank? Well, I get, I have X. So that's roughly, based on your burn rate, 3 months. Yeah. Okay. Well, we'll talk in 4. Right? They're going to be in this strength, he who has the gold. But they'll be on the brink of disaster, and they need this money. And it's a very difficult place to be in, because when that deal gets structured with that VC, should it go forward, you're going to see founders and founding stockholders get watered down, diluted, lose any form of say-so. And, you see over and over again, yeah, it got funded and it went out, became very successful, and I got my principal back, and I got a nice modest return back. The big money that came in later, made thousands of percent on the dollar, right? 3,000% on the money, 5,000% on the money. Some of them even bigger than that.
All the work, very little return, little work, all the return.
And it's so terrible for those that did all the heavy lifting.
Yeah.
And but I always say, the entrepreneurial is a great adventure. If you had told me all the things that could go wrong, all the setbacks, unforeseen challenges, if you told me what it was going to cost, right? Especially in the earlier deals I did when I was younger, and the complexity, I never would have started. Sometimes it's better, you need to know, but sometimes it feels like it's better not to know, because if you did know, you wouldn't even begin.
Right. Yep. 100%.
Sometimes you need to get on the hook.
So one other question that I have before we start to wrap up here, we talked about COVID-19, and we're all shifting gears here. What are, and everybody's talking about the layoffs and the unemployment, and, just all of the negative components of it. As an entrepreneur, what is most exciting to you? And not thinking about this as, I'm an opportunist, and I'm going to start, selling some sleazy snake oil. Like, we're talking about ethical things and moral things that entrepreneurs can do, because you mentioned earlier, and I think that's very true, that every single business out there is at this crossroad. It's going to be the time that they either go belly up, or it is going to be a catapult for growth, unimaginable growth that they never even could have predicted. So as you kind of start to pivot in your own company, and I know this is, evolving daily, and it's very, very dynamic. You may not have even thought through all of this.
Oh, yes, I have.
Okay. So what is most exciting to you as you think about how you're going to leverage the opportunities that are in the silver lining in all of this chaos that we're facing?
Well, there are, so first, once you learn your capital, I think the next most important thing beyond team building is contingency plans. You ought to think about them in advance. I don't care how good you think you are, your factory partner is at building a product. At some point, you're going to update some firmware or software somewhere, and it's going to introduce a bug, and there'll be some product recall or need to pivot, right?
Right.
I've been through complete catastrophic collapses of all national distribution changes, the worst market correction in history. That 2008, 2009 hit was very difficult, put a lot of people out of business. And so now when we look at things, we say, what is everything that could go wrong, and how are we going to respond to it? This particular current event with this particular pandemic. And we've seen bird flu, swine flu, SARS, and this is a form of SARS, right? I mean, its technical name is, it's SARS-CoV, -2. And it just attacks the respiratory system. Here's what's great about this. For us, personally, we were in a position where we immediately could start helping people in the areas they needed help. And it became very apparent when the first cases showed up here the same day. We were literally starting to sign up our own staff so that we could monitor them for temperature and symptoms at home. We do it in the morning and at night to make sure that they don't enter the workplace if they're infected and expose the faculty, right? Mm-hmm. Well, that immediately translated to home care companies, senior living, providers. People started realizing, I got to monitor my own staff. There's huge liability to my resident population or to my other healthcare workers or my patients in a surgical center. So suddenly people start coming to us, and it's not just about the patients, it's about the people serving the patients. Now we're monitoring and protecting them. But, this is going to happen again. Last year, we had one of the most resilient, most destructive strains of influenza. And what's happened through this event is the focus on connected care. We've been hearing for decades, we can't do it with outdated infrastructure, and we can't do it with the minimum number of beds when we have 130 million people with chronic illnesses, and we've got a 48 million, population of chronically ill older adults that's doubling in size in 3 decades, right? How do you fix that in that short period of time? So for years I've been hearing, we have to extend support for care outside the doctor's 4 walls and into the home. And what this event has created worldwide is now connected care is getting its spotlight. Now we're going to be able to show, we've started, Medicare as a reimbursement for monitoring patients at home. So we have a lot of older adults that are chronically ill, and we're monitoring them. And it's a reimbursed service for the doctor and for the service. And we started working with diabetics, and we looked at so the first 1,000 patients that went on that were the Medicare patients, we looked at 300 diabetics, and their HA1C levels were literally dropping across the board as they continued to use our service because the support we were providing in the home was helping them more effectively manage their disease. We had a practice put on a first, group of patients in Mississippi, and the doctor had just made a blood pressure change. And because of the monitoring at home and everything happening in real time, this patient took a reading, had a blood pressure of 70/30. Immediately, a nurse triage team through our Smart Hub was connected to the patient, concurrently notifying the family, and then carried the message instantly to the physician who said, we just made a change. How would I wouldn't have known, right. Until potentially some catastrophic things could have happened, right? The next thing you know, she gets dizzy, she falls, she got broken hip and a head trauma, right? So these things really make a difference. Now the opportunists out there are figuring out, how can I transform my app real quick and go out and tell people that they can work through their, mobile device and kind of self-triage and stuff. That isn't going to do it. People aren't going to continue to thumb through apps and menus and decision trees, and they need something that's more capable and also more user-friendly, and it's got to be connected into the ecosphere in a much more dynamic way. Yeah. And I think what we're seeing now is people are talking about digital health, connected care. It's time to start looking at technology in the home to improve outcomes, to reduce pain and suffering, to stop people from having those head traumas and broken hips through early identification and expediting intervention. And because now they're finally opening up greater access, greater reimbursement resources. And what they're going to see virtually overnight is just how effective this really is. And it's the birth of an entire new global industry. And it's literally the moment we're going to truly transform the healthcare industry.
Isn't that
That's
incredible?
what I'm excited about.
I completely agree with you. I mean, I think that, when you look at the technology adoption curve and you're coming out to market with something and you see this small little market that's going to buy and adopt first, right? And you've got this gigantic piece of the market that's like the laggards, right? In the late and early majority. And they want to hear, like, they're not buying for many years, right? And that's part of the challenge that we've had in the system is that, people, brilliant minds like yourself have innovated these really exciting ways for us to really transform the healthcare system. And there's been regulatory and legislative barriers and hurdles that's been challenged to overcome. And then you just had all these laggards and late majority adopters that are just like, I'm not ready yet. And that's changing, right? And so we're going to see this trajectory of adoption, just like you described. And I think once people, physicians that were like, I'm not doing telehealth, patients that were like, I want to be with my doctor in person, that's going to be changing. And once they get a taste of, this is really not so bad. This is actually more convenient. This is actually more effective. They're not going to want to go, a huge chunk of those people are not going to want to go back to the way it was before COVID-19.
Yeah, I agree with you 100%. I've seen, it's been interesting that here's this huge at-risk population, the chronically ill, that are older adults, right? And the benefit's been in place now for over a year. And I'm surprised at the physicians that have not picked it up. Now, they have to use good discernment because everybody, like I said, is throwing an app and just give them one device and download this app and you can put this out and get reimbursed for, doing remote patient monitoring.
Yeah.
That doesn't work. You've got to make sure that you have redundancy and security. If you lose power, if you lose internet, there should be emergency response. There should be medication management. Everything should be happening in real time. It shouldn't just be, I decide to look up some of the charts in a week.
Right.
We're taking readings. We're seeing they're out of threshold, or we're seeing they were prompted to take a reading and they didn't take the reading, and we're engaging in real time. So they have to make good decisions. But, one of the other great things about this moment in time is that we're going to get struck again, like I started to say before. As soon as we get through this, we're going to have another rampant influenza season.
Sure.
Every single year. And it hits the same members of the population, except it takes the younger as well, right? So we're not seeing as many kids. It takes more children. And it's still taking down and the numbers are epic, still taking down the older adults. So now that we made this transition, I think that the world's going to be really surprised to see with some of the new skill sets and some of the new practices and some of the new sanitation routines, some of the distancing. We're going to now be able to use this technology to suppress the spread of influenza every year and the damaging consequences and reduce the mortalities and long-term complications through that early identification, better management of the process, getting in there early, and starting to immediately put in practices, right? You look at, we've got whole adult living, assisted living, nursing homes, independent living facilities for older adults.
Yeah.
Monitoring now their staff and monitoring all of their patients, their residents, who many are patients, and saying, we're never going to stop doing this.
Right.
When it comes into the fall, right, and the influenza spray, now we're going to be able to make sure that an infective worker doesn't come in and wipe out our resident population. And we're going to be able to know who we need to quarantine down and get treatment to, who might have otherwise infected 120 or 180 other residents. It's going to change everything for the better.
Yep. I completely agree. Well, I'm glad we were able to end on a positive note, and all of the opportunities that are hidden and maybe even not so hidden in what we're facing today. So, Anthony, thank you so much for your time and sharing your wisdom with our listeners. It's been great, and I appreciate your candor and transparency. How can folks get a hold of you if some of our listeners have some questions, either about your solution or just about your business insights?
So we have a pretty simple number to remember. We've got 833, and it's Electronic Caregiver, right? So it's 833-ECG-LIFE, 833-ECG-LIFE. And the easiest way online is to just look for Electronic Caregiver. You'll find our website. It's electroniccaregiver.com. And they can learn about Addison and see this new, lifelike, talking, incredible, interactive friend and care partner and caregiver and nurse. And, so they can see some really amazing stuff that we're developing, as well as some of the incredible solutions that we're deploying right now for government and facilities and patients across the country.
Well, I look forward to staying in contact with you to see how you grow in the next few months and the years to come based upon what's happening. Thank you.
Hey, all right. Thank you.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and your attention. To save time and get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who's been sharing the show with friends and colleagues. See you on the next episode of COIQ.